Hello and welcome to Unit 2B entitled What are the Issues? Now all of us are aware of the complexity of healthcare. The fact that for any action, any intervention that we bring in, there may be planned consequences and unintended consequences. There may be what we call ramifications, where what we're doing in one area has a knock-on effect in another area. And because of the complexity of healthcare, a health programme, when it's being evaluated, when we're producing an evidence assessment, will require different types of information to answer different types of question. In fact, perhaps each of the different types of question will require different study types. So some may require randomised controlled trials, others may require qualitative research. And just drawing on our own experience here at ScHARR, initially, like many worldwide, we would do reviews of clinical effectiveness, largely populated by randomized controlled trials. But subsequently, as evidence has been brought to bear on more complex issues, or indeed that the complexity of the issues have been recognized, and decision makers want to be informed around a number of areas, a number of dimensions, then we've seen the introduction of approaches to reviewing cost effectiveness studies, to looking at the acceptability of interventions to patients, and indeed look at the experience of patients when trying to see what it's important for an intervention to achieve. We've seen the growth of an industry in reviewing studies of adverse effects, in the recognition that any intervention should not just be judged on its benefits, but on also the likely adverse consequences. Increasingly, we see qualitative research and the result of process evaluations being used to look at issues around implementation. So what are the attitudes of staff, for example, of creating a particular clinic in a particular area or offering a particular treatment? This added complexity has led some observers to ponder on the possible relevance of systems theory when identifying and nominating questions. And the value of that is that systems theory looks at the interconnectedness of the different parts, and it's increasingly being cited when mapping complexity. And what you'll observe as you go through this particular unit is that we look at some simple ways of capturing evidence needs through frameworks such as PICO, which stands for Population, Intervention, Comparison, Outcome, POCO, which is a similar one but which looks at particular policies, FAME, which is feasibility, acceptability, meaningfulness to the patients or to the staff, and effectiveness with the addition of cost effectiveness or efficiency, and CIMO, context, intervention, mechanisms and outcomes. But as you will see, when we're trying to break down a complex issue using a single question framework, we may end up with multiple attempts at phrasing different though related questions. And so to recognize the inherent complexity, increasingly people are considering the use of logic models, where you can map the cause and effect relationships between doing something what we call upstream, which is at the point of planning and delivery, and affecting things downstream, which is at the point at which outcomes are achieved. And logic models have a lot of potential in the context of evidence assessment. They can be a diagram against which to map the evidence, so we can see where particular effects are well supported by evidence or where there are evidence gaps. They can be used to identify critical points in the chain. So it may be that if we direct all our efforts and all our resources at one particular point, that can potentially achieve more than spreading our efforts and resources along the whole logic chain. And also, because they're diagrammatic, they can be used for looking upstream so that we can see how things that we attempt and achieve further up the line may actually mitigate likely outcomes or effects at the end or downstream. So, for example, health promotion and health preventative measures have this idea that you will then be avoiding uptake of acute care services. Logic models can also be used for communicating some of the complexity of the problem to stakeholders, whether they be members of the public or whether they be decision makers, perhaps managers or policy makers at a national or regional level. And they can be used to explain that if we change this particular component or we change this particular intervention, this is the likely knock-on intended effects. And indeed here at ScHARR, Sue Baxter and her colleagues have used logic models for mapping some of the complex problems of public health. So, for example, things like smoking cessation, brief interventions for alcohol, etc. And in fact, that team will now rarely start a review without attempting to map the particular problem using logic models. And what you'll see in this particular unit is a pointer to some web-based resources to help you think about logic models for your particular problem or health issue that you're choosing for your assignments. Of course, for all of you, you too face a complex issue, and that is, when are you going to be able to fit in the time to read the remainder of Unit 2B? What are the issues? Thank you for your attention.